Hi everybody, my name is Dr. Hilary Booth and I'm a naturopathic doctor. Welcome to my video blog. Today we're going to be talking about hormone imbalances. This is something I commonly see in my practice, and it's something that a lot of patients don't realize that they have until I start to point out some of the signs and symptoms. And of course until we do lab testing. So some of the common signs and symptoms that I see are acne, especially for women around the mouth area and jaw, and as well as for both women and men on the chest and on the back. Something else I see in women is facial hair growth, as well as some male pattern balding. We also see PMS-like symptoms, and these can be mood swings, these can be bloating, this can be fatigue, breast tenderness especially. Problems with menstruation that can include scanty menstruation, meaning that it's barely there or not at all. Or we may see major painful menstruation with a lot of clots and heavy bleeding. And we may see menses lasting for over a week or menses that last for under 2 days. All of these are considered to be irregular menstruational patterns, and they should be looked into further by your naturopathic doctor or other healthcare specialist. So when I do start to see some of these symptoms of hormone imbalance in my patients, oftentimes if they can afford it or they have a medical doctor they can go to, we do request a hormone panel. There can be imbalances in the male hormones, that's your testosterones, your androgens, your testosterone, your female hormones, which are typically your estradiol and your progesterone, but they can also include your FSH and your LH as well. Some of the things that we can do for you if you are experiencing hormone imbalance, the first thing is to make sure that you are properly building your hormones. So that means that you're getting enough protein in your body, you're getting enough good solid fats. Hormones are made mostly from cholesterol, which we tend to start thinking of as this bad thing, but there actually is good cholesterol, and you do need it in your body in order to make any of the hormones that we rely on a day-to-day basis. So keep that in mind. The second thing is to make sure that you have the correct nutrient status. Certain things can deplete nutrients in your body, and they can affect how your body makes and processes its hormones. Something that's a really common thing that I see is vitamin B6 is low in patients who are on the birth control pill. So that can be something to look into. The other thing that I consider is whether the patient has PCOS, which is polycystic ovarian syndrome, which may have been diagnosed previously by your doctor, or it may be something that we need to look into together. That can be through lab testing, through your clinical symptoms, or also through a transvaginal ultrasound. The other thing that we look into for imbalances in hormones is whether or not you're eliminating the hormones properly from your body. If they aren't being eliminated properly, they are going to be reuptaken back into circulation again, and they're going to cause problems because the levels are going to be too high, which throws your other hormones out of balance. So I look into whether the patient is experiencing constipation. You should be having at least 2 bowel movements per day. For some people, this is a crazy idea that they should be having that many bowel movements per day. Obviously, this varies. Some people, it's very normal for 1 bowel movement per day. For some people, it's very normal to have 3 or 4. What we're looking for is that they're well formed. There's no straining. There's no grease in the stool or in the toilet bowl. There's obviously no blood or mucus. I'm sorry I'm talking about this so much. And that you're not having any sort of cramping or bloating that's associated with your bowel movements. So once we get your bowel movements on track and really flowing the way they should be, that's helping to eliminate from one perspective. And the other way is by making sure that your liver is processing your hormones properly. So a lot of times our livers aren't working at optimal speed. So that means we need to give the liver some support. This can be really gently done, sometimes with something very simple like lemon water and castor oil packed, which I can explain to you if you come see me in my practice. Sometimes we need to give it a little bit more help. This could be with supplements and with food items that can really help to rev up the work that the liver is doing, and you want to make sure that you're doing this safely. There are 2 phases to your liver detox pathway, phase 1 and phase 2. If you amp up phase 1 and you don't amp up phase 2, you'll get a backlog, and those products that have been partially processed from phase 1 and aren't allowed to go through phase 2 because it's backed up, that can actually cause more harm than good in your system. So be careful about that, please. Overall, what I like to do with someone with a hormone imbalance, once we get our lab work back, is I like to do a detox or a cleanse with someone if that's what they require. And I also like to look into ways of rebalancing the hormones using gentle herbs, and again, using different nutraceuticals, that supplements, and sometimes using lifestyle and dietary modifications as well. For more information, you can always visit my website at www.hillarybooth.com. That's HILARYBOOTH.com. You can go to my contact page and you can fill that out, and that will send me a message and ask any question that you like, and I will do what I can to help. Or you can always call the office to book an appointment, or you can book your appointment online from my website. Thanks very much for watching, everybody. Take care.